In this video, we're going to talk about strokes. If you haven't watched my last video about heart attacks, I recommend you do so. Some of the key information is transferable to this topic as well. In a heart attack, the vessels that feed the heart tissues become narrowed and then blocked. This leads to a lack of blood flow and causes the heart muscles to die. A stroke is essentially the same thing, but instead of it occurring in the heart, it occurs in the brain. There are two types of strokes. The first is an ischemic stroke. This is the type of stroke I explained earlier. This occurs when there's a blockage in one of the major vessels in the brain. Plaque buildup leads to a narrow blood vessel. This causes a decreased blood flow and potentially brain cell death. The second type of stroke is known as a hemorrhagic stroke. This is a result of one of the vessels in the brain rupturing. It's lesser common, but it's more dangerous. You may have heard of the word aneurysm. It's the same thing. An aneurysm is when the artery wall becomes weak and it balloons out. When this eventually pops, the person is in serious trouble. A hemorrhagic stroke is just a brain aneurysm. The major signs and symptoms are numbness to one side of the body, major sudden headache, difficulty with speech or understanding others, confusion or change in mental status, and of course, visual disturbances. If you can remember the acronym FAST, the F stands for face drooping, the A stands for arms, are you able to raise them? S is speech is slurred, and T is time to call 911. Now, time is the most important factor in decreasing the effects of a stroke. It makes sense because the more time that the brain is without oxygen, the more damage that is done to the brain cells. The main treatment for strokes is TPA. It's used for ischemic strokes only, and it breaks up blood clots in the bloodstream and then allows the blood to flow to the tissue more easily. This treatment can actually work miracles, and often people have no lasting damage once they're treated on time. The issue with TPA is that it can only be given under a certain time frame. The science is changing, but the golden time is within 3 hours of symptoms starting, but some patients can receive it up to 4.5 hours after symptoms. So being able to notice these symptoms quickly can increase the person's chances of being sent to the hospital within this time window. There are other treatments as well, like various forms of clotbusters, and surgery will be done under the scenario for a hemorrhagic stroke. A TIA, or a transient ischemic attack, is known as a mini stroke. These symptoms will mimic a stroke, but the effects generally only last 24 hours, and no lasting damage is usually done. This can be compared to angina of the brain because it's like a precursor to a stroke. Last video I talked about angina, so I figured it might be important for you to understand what a TIA is if you understand what angina is. Thank you so much for watching. I hope you learned something and enjoyed the video.